I almost surprised myself saying September. We're that far along in the year and it's all gone so fast. My name is Cecile Town. I am the Deputy Program Manager for the Immunization Program, and I will be facilitating today's meeting. So welcome everybody, Ipat members, OHA team members, any guests that we have today. So Anne, can you please post the agenda again? I'm not seeing it. Do you have it posted on the screen? Thank you. All right, just to run over the agenda for today, we're going to start out with these welcome introductions as we're doing now. We do not have a public comment section today. There were no people that requested to do that. We will have an update on ACIP and related policy issues from Dr. Seidlinger, and Amanda Timmons from OIP will also take part in that as needed. The state of the program update from Kelly McDonald, a school immunization team update from Kelly Gano, and an Alert IIS replacement project update from Jenny McKibben. Before we get started, I would like to introduce everybody to one of the new managers on our team. Robin Marduz Flood is here, and he is the Vaccine Supply and Access Team Lead. Robin, why don't you take a moment and introduce yourself?
Thank you, Cecile. Can you guys hear me okay?
Yes.
Good morning, everyone. Very happy to be here. I joined OHA in mid-July after nearly 20 years of federal service. I guess exactly 20 years of federal service, 18 of which was spent with USAID as a health officer. So primarily working under authoritarian regimes to advance public health through crises. Very different than what I'm doing here. So pleased to meet you all and thank you for the warm welcome.
Thank you, Robin. Let me see here. I think I had one other update that I wanted to make sure to offer for you all. I think I will come back to it. Reading the comment from Rex in there. So with that, let's just go to the first agenda item for today. So is Dr. Seidlinger on the call?
I am Cecile. Thanks for your
Wonderful.
flexibility.
Thank you.
Poor Cecile, I told her today I could come on time, then not come on time, then come on time. So, hello. Should I just dive in, Cecile?
Yes, please do.
Okay. So, hello, everyone. My name is Dean Seidlinger. I use he, him, his pronouns. I have the privilege of being our health officer and state epidemiologist. I am no substitute for Paul Cisak, who is often here wearing a bow tie. I decided to forego my bow tie today so you wouldn't confuse me with Paul. So, what do I have to talk about today? Let me just say first a broad thank you to all of you. As we work in public health and prevention spaces across healthcare to promote immunizations and help ensure protection in our community, it's been difficult over the last few months. I think we've seen devastating impacts on our federal workforce, on our funding cuts. The vitriol directed at public health and kind of government workers in general has been tough, but yet we persist in trying to assure that people have access to accurate information as they make decisions about getting vaccinated and for themselves and their families, knowing the tremendous positive impacts that vaccines have had and continue to have. We saw actual physical violence directed at the CDC, and we see continued erosion in the data and the recommendations that come out of our federal partners. And so, with that, we have been having conversations over the last many months about how do we support current vaccination efforts, build on what would have been successful pieces, and ensure people have access. In my mind, as we kind of weather through this, there's three main buckets of work that we have to do, none of which are easy, but they, in order of increasing difficulty, it's to minimize confusions amongst our providers about vaccine recommendations. It is to ensure appropriate payment for vaccines and to improve public confidence in vaccines. And all of those things are extremely difficult right now. With that, Governor Kotek, along with her colleagues, Governor Newsom in California and Governor Ferguson in Washington, announced yesterday West Coast Health Alliance to work on public health guidance in the face of lack of information or misinformation from our federal partners. And let me just pause and say, when I talk about our federal partners, there are so many thousands of dedicated CDC staff and other federal staff that are continuing to work to try and promote the public health and support programs to improve health. I'm speaking of some of the more political leadership and top leadership in Health and Human Services Agency that are really where we are fighting. So this West Coast Health Alliance is still being kind of formulated, but it's essentially based on our work that we did together in COVID on many guidelines and recommendations. We'll kind of formalize that. It'll be based in some of our public health leadership across the states. The initial issue, because it's most urgent, that we're going to focus on is vaccination guidance, and particularly fall respiratory vaccine guidance. I don't have to tell you all that, we are operating in a state where the reformulated advisory committee on immunization practices made some unusual decisions at their last meeting. The presentation around thimerosal and the decision to remove thimerosal containing flu products from the schedule, I think on its face makes sense, but nothing has changed in the data that we have, and it's such a small part of our vaccine program. But it's was an idea that one of Secretary Kennedy's people brought to him and that he brought to the committee. They pushed off the decisions on fall respiratory viruses as concerns to COVID. They did support introduction of an incorporation of new RSV prevention products, which is great. And we have some recommendations around flu, but it leaves us all kind of in limbo as we, have gone past Labor Day and are approaching fall, and when we typically want to start encouraging people to get their vaccines, and we have a flood of a morass of information. So one of the first things the states have done together is to say we need some evidence-based, data-driven guidance to provide out to providers, to you all, to people wanting vaccines, and then we can build from there. We feel confident and support the childhood vaccine schedule that was released by the American Academy of Pediatrics about a month ago. They've been in the vaccine recommendation game longer than the CDC. And we've been very fortunate over about the last 25, 30 years that the American Academy of Pediatrics and CDC, ACIP recommended vaccine schedules and recommendations have converged. But now I think we're going to start to see more divergence. We don't currently have any ACIP recommendations for the newly approved and authorized COVID vaccines. So we stand by those AAP recommendations. Their COVID-19 recommendations are universal vaccination for 6 to 23 months and risk-based vaccination from 2 to 17 years until people turn 18. So that is based on underlying medical conditions, living in a congregate setting, or if a parent desires their child to be vaccinated, or an adolescent who can consent desires a vaccine, that they should have access to that. People living in with someone who's at high risk may choose to get vaccinated. The American College of Obstetricians and Gynecologists reaffirmed the importance of vaccinating pregnant people to offer them protection at a time when they're at higher risk. and also offer some protection to their newborn infants. And so we stand by that recommendation as well. You know, we're kind of the FDA approval had vaccine recommendations for those over 65 and then under 65 with underlying conditions. We're still waiting for some kind of adult under 65 recommendations to come out for the updated season for the updated vaccine before we kind of endorse a set of vaccine recommendations. We endorse these professional society or support these professional society recommendations rather than doing our own because we thought doing our own would just add to the confusion. Re-reviewing their guidance would also might be confusing because they looked at the latest data. Who's being impacted? For example, in kids under 2 are this have the second highest hospitalization rate behind adults over 65. You know, they're looking at who any new safety signals or safety signals in the vaccine, and we have no evidence of safety issues that have arisen in the last year since ACIP fully reviewed the data. We look at the efficacy, how well are the vaccines working? We continue to see, impact of protection from disease in the short periods after vaccines are given, but then protection from hospitalizations and more serious complications over the longer period. So we stand by those recommendations, and they did it in a way similar to how ACIP and CDC would have done it, with a review of the data in a transparent process, and then presenting them in public fora. So we stand by those. The hard work across Oregon, across the other states in the West Coast Health Alliance, as well as all states really, is how do we assure that we maintain access and payment? So those conversations didn't just start with the announcement yesterday by the governors, but has been ongoing and are stepping up even more with our Medicaid partners, our PEB and OEB, other public insurers, with Department of Consumer and Business Services, with our Board of Pharmacy, to ensure that we can maintain access and coverage. Right now, I can't tell you that that's a guarantee. No, many folks have at least verbally committed to covering vaccines that OHA and the Alliance, the professional organizations, are recommending, but there's a lot of work to be done. The reason we're really concentrating on pharmacies as an access point initially is because about half of our COVID vaccines in the last year were given in pharmacies. Many of our flu vaccines are given there, as well as other vaccines. And so we want to ensure that an access point that many people depend on in Oregon doesn't go away. So with that, I'll kind of stop rambling and see what thoughts or questions or concerns you have. And if you have questions, I'll try and answer them. If not, many of my answers these days are, we're still trying to work that out, and we'll get back to you. Cecile, were there things you wanted me to cover that I didn't?
No, I don't believe so. I do think that we have a few questions in the chat that we can start with. And then if folks on the call can tell us what they're hearing and ask additional questions, I think that would work out just great. So the first question that I see on the chat here is from Janet Patton, and it says, why are pharmacies requiring a doctor's prescription for COVID vaccines now? It seems like an unnecessary barrier.
So, pharmacist vaccination in Oregon, as in other states, is governed at the state level. And so the regulations and the regulations come down to the Board of Pharmacy, and the rules are held by the Board of Pharmacy. We do have in those, I don't know if it's in the regulations or the rules, but a referral to that pharmacists are able to vaccinate based on ACIP, CDC recommendations. So pharmacists right now have, because I know I was in line at Walgreens the other day, have their COVID-19 vaccine for the upcoming season. The person in front of me asked for, said he'd heard in the news he might not be able to get vaccinated there. Did they have COVID vaccines? Could he get vaccinated? And their answer was, yes, we have COVID vaccines, but no, we can't vaccinate you. And that's because for the pharmacist to vaccinate that individual, with the new vaccine, they need a recommendation under ACIP guidance, and they don't have that right now. So if he returned with a prescription from his provider, they would be able to provide that vaccine. We're working with the Board of Pharmacy to see what steps can we put in place to assure that pharmacists can still vaccinate based on professional society recommendations that OHA stands by and supports without requiring the prescription. But there's some issues that have to be walked through, and we need to see how to do it best in our regulatory framework. Our partners to the north, I believe, are doing a standing order that's going to help. That could be a possibility here. There could be other things that we need to change to try and ensure that those access points are continued, but we're working through it. And to add to that, like we've been hearing that CVS and Walgreens are doing different things in Oregon. And so we need to be able to work with the Board of Pharmacy to provide some clear recommendations and work through those so that hopefully we can minimize confusion and keep access. I'm just going to move up, Cecile, unless you want me to kind of start from the top.
Yeah, no, I think that's okay to just take
Right.
them as you see.
So, yeah. So do you know if VFC, flu, and COVID vaccine allocations will be reduced this year? I'll start with any of my colleagues in the immunization program to see what they've heard, and then I'll give you some thoughts building on that.
Hi, this is Robin. Good to see you all. At this point, no, we have no indication that the allocations will be reduced, but there are still a number of questions that we're working through in the decision fog that we're all in the midst of.
And I would just add that since we are still awaiting like the COVID recommendations out of ACIP and CDC, that I don't think COVID vaccines are even available for ordering right now in because of that. And also, I think everyone is a little leery about what do we order, like what can I actually give to my patients. And so we know there's probably going to be a delay, which is why we're working as hard as we can to try and clear through some of these kind of regulatory hurdles. It was really nice last year when, the ACIP, independently looked at the data, made a recommendation based on that data that we could all see where that recommendation came from, and then automatically vaccines were covered for VFC and ACA, and that's just not the process we're in right now. But if we take on some of this responsibility at the state, we have to build a lot of things in to kind of work around those, and we're doing that voluntarily and also looking where we can pull levers through rules and other things that are offered to us. What documentation is recommended for providers to demonstrate a patient is a high risk and/or meets other conditions outlined? So I will say this veers a little bit into kind of liability issues and other things. So not a lawyer and not giving you legal advice. But I think most times just attestation. So at a pharmacy where maybe that intense clinical relationship doesn't occur, but an self-attestation by a patient or a parent on behalf of a child, that their child has or they have an underlying condition is usually enough. As for what you would need to, document, it's probably that self-attestation if you do it, or if you're their provider and have documentation of that, that should suffice. But it's not typically something that has to be specially documented to give that vaccine or to prove the eligibility. And it's why we kind of stand by these professional organizations that also say that, hey, if someone just desires protection from a vaccine, that they should be able to get that as well. And so we're working through that and working through trying to assure that those would be covered and paid for. We answered another VFC question. I think I got the questions in the chat. Yeah.
You saw the one about COVID vaccines being available and paid through VFC?
Well, I think we kind of went through VFC reduced allocations. I don't know. This is one of those like shoulder shrug emojis. I think it depends on what. So we have a strong universal flu vaccine recommendation from ACIP. which drives VFC coverage. So great, flu, we can answer. Didn't really ask about RSV, but RSV, we also have those recommendations. What we don't have is an ACIP COVID recommendation for the upcoming vaccine. And unlike the annual flu vaccine, which just kind of says the annual flu vaccine or seasonal flu, I can't remember what it says, but the ACIP and CDC recommendation for COVID is tied to the strain by name. So, like it was tied to last year's vaccine, the one that we hope to get September 18th or 19th out of the ACIP meeting will be tied to the recently approved and authorized FDA approved and authorized COVID vaccines. So until we have that, I don't think VFC can cover it. We are not waiting for that as we have our conversations with insurers, particularly our Medicaid program and others, about what are our other options if by some chance it doesn't come through as an automatic coverage. And no guarantees, but lots of conversations happening to assure that children still have access to COVID-19 vaccine without any out-of-pocket expense for those parents.
Thank you, Dr. Seidlinger. With Dr. Seidlinger here in the room with us, I would like to take the opportunity to ask our membership what they're hearing, what kinds of questions they're getting. I think it would be good for us to be aware of that.
And I'm not believing you're not hearing anything.
I mean, I'm getting tons of questions from my patients, just mostly about availability and insurance coverage. And I do a mostly pediatrics practice, and so I'm not really sure where else, depending on availability of COVID vaccine and when we're able to get them in. There's a lot of questions about that as well. And I'm not able to give anybody any guidance on when we'll have COVID vaccine, who will be eligible, what insurances will be covered. So there's a lot of conversation. My patients are super informed.
Thanks. And several insurers I think have made a decision. And so checking, hopefully they're proactively communicating that out. But if not, checking with some of the major insurers that you take, you may have that answer now, but we're trying to make sure that we have some universal pieces and then to pull the levers where we can in the public side, because we have a little bit more leverage there. Yes. Deborah.
Hi, this is Deborah. I think a lot of the questions are coming from the practices. You've covered them in your previous questions, but have been, what's needed, who can I give the COVID vaccine to? When is it available from VFC? Will it be, which then links to the coverage for the OHP patient population? Will commercial cover it? Will they only cover it for a certain age group? What do we need documented? Yeah. We've never had to give a prescription for a vaccine before, so even some are trying to get it through a pharmacy just because maybe they can get it there quicker, but just finding roadblocks each way. There's just was a lot of confusion also with the types of with the Pfizer vaccine not being approved for the same age group. So a lot of switching and what they had to purchase between Pfizer and Moderna, depending upon what they had practiced before. But they're really trying to understand, what the guidance is too with like provider consult, or like how do they get that the patient desires and what's appropriate. And so I think clear guidance, like I know you're or recommendations on what could be documented. Conversation with the patient. Together, we decided that it makes, that the patient should be vaccinated. Like even just scripting could be helpful of what might be able to be in the medical record, just in case the insurance company comes back and says, we're not covering it.
Right. Okay.
Yeah, but the timing difference between what they can do with commercial now and not having it available for VFC is challenging.
Yeah, and I know we're going to be issuing a lot of things and maybe some quickly changing messages. I think, which I know is going to add to confusion, but I think it's just the confusion was thrust on all of us, and so what we're doing is just trying. There's a lot of piecemeal things that have to come about, and each state is has to do things a little differently based on our regulatory environment. So we will be moving as quick as we can and trying where we can provide assurances or get commitments or other pieces around insurers or pieces. We will do that and communicate out as much as we can. But I know that it's going to change a lot and hopefully fairly quickly over the next few weeks and months. Rebecca.
Yeah, thanks. My name is Becky Sherman. I'm a director of nursing at La Clinica in Southern Oregon, and I would just really encourage if we do end up in a shared clinical decision-making framework. I know that already we're pretty clear for our other vaccines that nurses can make the shared declining. I would just say for the in the world where we don't have enough providers, really making sure we have that strong recommendation for nurses to be included in that conversation will really help with access. That would just be my.
Okay. And we have upcoming meetings with the Board of Nursing, and we'll see what we can do to work through that. And our goal is ideally to increase access, but definitely not to decrease access over what we had before this current situation.
Other questions or comments from our membership?
I see a question in the chat. Do we have a go-to location on the website with updated information? I don't know that we have it yet. It's something we're working on, and I'm not sure if it's going to live on our federal. We have a page that talks about what the federal changes mean in Oregon and how we're responding, or if it'll live somewhere else. I think I'm not putting my partners in the immunization program on the line by saying, as soon as we get that, we will send it out in a listserv message to you guys, so you have one place to go to, and also to send patients or partners to as well. And I know they also will be trying to summarize where we are right now and send that out in a listserv message to folks who vaccinate. So yeah, things are moving fast. So I don't know if that landing page is up yet. If it is up before the end of Ipat and I can find it, I will send it to you.
Thank you for those comments, Dean. I think everybody is wanting to get information out as quickly as we can, and we appreciate working with you on, making sure that that communication is right and ready when it's ready. So we appreciate everyone's patience as we are in the middle of the situation. Thank you. All right, any more questions, comments? Okay, Dr. Seidlinger, thank you so much for joining us today.
Thanks a lot.
Appreciate your time while it's so busy.
Thank you.
Okay. The next item on our agenda is a state of the program update from Kelly McDonald. Kelly, would you like to jump on and give a brief introduction and do your presentation?
Sure. Hi, everyone. Kelly McDonald here. You can hear me, right, Cecile? Okay.
Yes.
Great. Kelly McDonald here. I am the Immunization Policy Project Manager with the Immunization Program. I've shared updates. Gosh, I think I share an update every time. So you're used to seeing me at this point. I want to provide two separate but related updates today. The first related to legislative outcomes that impact our program, and then the second, an update on vaccine finance reform efforts that are underway. First, I just to make sure, do some level setting, make sure everyone's on the same page, want to provide some background on the vaccine access program. That is a critical program that supports safety net immunization providers in Oregon, including local public health departments, many federally qualified health centers, school-based health centers, and other sites that serve those at higher risk of poor disease outcomes. So those who are uninsured, OHP covered individuals and families, for example. And over the past many years, that program, the VAP program, has been pushed to its limits. That's because of rising costs and increasing demand. That program started, VAP started back in the early 2000s, around 2003. And over time, the number of vaccines and the demand for that program has really pushed it to its budgetary and staffing capacity limits. So because of that, enrollment in VAP has mostly been paused since March of 2024. We have some very limited exceptions to that, but for the most part, we have not enrolled VAP providers and we have maintained a wait list. That wait list has grown to 53 at this point, clinics and pharmacies on the list. This work around vaccine finance reform is driven in large part by the Vaccine Access Program no longer being sustainable, wanting to ensure that we support access, that we can ensure access around the state, and that providers, immunization providers, that we can reduce some barriers to providing immunization services. So we had our vaccine finance summit back in January of 2024, followed by our vaccine finance reform steering committee. That group met from May through September of 24 to identify barriers for providers and explore different options to modernize our funding structure, so how we pay for and distribute vaccines in the state. And out of that came Senate Bill 42. Senate Bill 42 was introduced by external partners, worked with legislators to provide funding that would sustain the vaccine access program. That funding would provide some vaccine funding and some operational funding for staffing to be able to enroll that wait list of 53 clinics and expand to new providers. So that at least in the short term, we could shore up our vaccine access supports in the state while continuing to reform our current funding structure. Unfortunately, Senate Bill 42 did not pass in the 2025 session, and that coupled with reductions in our federal grant funding, so our CDC-based grant funding, those two things together have left us without sustainable funding to support VAP, without staffing capacity to enroll new sites. So VAP enrollment is effectively closed at this point with, again, some very, very limited exceptions. This freeze does not impact currently enrolled VAP clinics, so they are still enrolled in the program. But those on the wait list won't be enrolled until sustainable funding is secured. We can still add new clinics to that wait list, but there is just no guaranteed timeline at this point for if or when or if they will be enrolled. So we're directing folks to they can enroll in the Vaccines for Children program, directing folks to our help desk who can provide information if they're interested in being added to the wait list. We'll, of course, keep you informed here, and we provide updates through our listserv. Second piece is around the future of the vaccine finance reform effort. So I mentioned the Vaccine Finance Reform Steering Committee that met last year. That group did a lot of incredible work to narrow down, to really identify the barriers and to narrow down what potential new models for Oregon could be around vaccine financing. The group also ran out of time to form a final recommendation for a new funding structure. One of their recommendations was to recommend a new committee, that sort of a 2.0 that would pick up where the Vaccine Finance Reform Committee left off. So not to repeat any of that work, but to really start where they left it off, to continue looking at universal vaccine purchasing for Oregon, as well as other options to figure out what makes the most sense for that sort of sustainable long-term vaccine assurance. As we understand, there are external partners that are still working on this, on next steps for a new Vaccine Finance Reform Steering Committee. For those who are interested in learning more or getting involved, and would direct you to those folks who are part of those external groups who are working on it. So our Oregon Families for Vaccines group and the executive director, Meg Olson, can connect you if you're interested or keep you informed, as well as Oregon Pediatric Society folks. And I know we have a couple here on the call. I think I'll leave it there and have a few minutes for questions, or if there's anyone else on the call who's been involved in any of this work who would like to add to my comments.
I don't see any hands raised. Are there any questions or comments for Kelly?
All right. Thanks, everyone. Please also feel free to reach out to me as well if you'd like to be connected to those external groups that are continuing the efforts around vaccine finance reform.
Thank you so much, Kelly.
I did have a question. This is Dr. Patton. We were following a number of legislative bills, many of which were striking down requirements for school vaccination. I'm fairly certain none of those went forward, but I just like, because you'd think we'd hear it on the national news, but I just like confirmation that none of that backwards direction happened.
That is accurate. Amanda's our main lead for legislative, activities. Do you have anything else to add?
No. It was not an unusual session in that sense. We often see bills like that, but luckily they often die in committee.
Thanks, Dr. Patton.
All right. And what is up next on our agenda for today?
That would be school law, appropriately, with Kelly.
Kelly Gano, please join us for the school law update. Happy to have you.
Hi, thank you so much. My name is Kelly Gano. I use she, her pronouns. I'm part of the data systems and school law teams here at the Oregon Immunization Program. You might be used to seeing Stacy DCS Matthews. She's on vacation, a very well-earned vacation, so you got me today for the school law update. I'm going to try and share my screen real quick. I just put together a few slides to talk about what we're going to talk about today. So I'm just going to share some school law immunization updates, including some non-medical exemption rates for the 2024-2025 school year, as well as a recent change to the process for obtaining a medical exemption in Oregon that's particularly going to impact physicians. Some of this information you might already be aware of. None of it's super new, but we wanted a refresher as we move into this school year, and you're going to potentially get more questions from people. So the first thing I'm going to talk about is just a short walkthrough of the non-medical exemption data. This is all going to be available on our updated school law data dashboard, which I'll put the links in the chat when I'm done talking. This was recently updated. A lot of people on our program worked on it really hard, and the interface is super cool. So I encourage you, if you're at all interested about any sort of school vaccination rates in the state of Oregon, to take a look at that. This chart was put together by Stacy for another presentation that we did, and it shows us the Oregon kindergarten non-medical exemption rates from 1986 to 2025. This is all kindergartners who have one or more non-medical exemptions. You'll notice there's a couple of arrows here. The first one marks a decrease in 2015 after a change in the law requiring education to get a non-medical exemption. Then you see a little bit of an increase and then a sharp decrease in 2021. That was the first point of data collection after the start of the pandemic. And as you all remember, that was a difficult time for accurate info. So the drop to 5.3% in that year might have been due to challenges with data collection. Then we have the upward trend. 2024, the number was 8.8%. And then in 2025, the rate has increased to 9.7% of kindergartners having at least one non-medical exemption for one or more required vaccines. This next graph is just like a little breakdown of what it looks like in the various counties. Again, this is for the 2024-2025 school year. And these is any kindergartners that have one or more non-medical exemptions for required vaccination. Just a little explanation of the color scheme. The lighter the color, the less non-medical exemptions you're seeing. So that's just a little bit of information about what it looks like in our county. In terms of at the national level in 2024, Oregon had the fourth highest non-medical exemption rate in the United States. And this year we have the third behind Idaho and Utah. Idaho with 15.1% and Utah with 10%. There's a survey on our website on the page that explains how to obtain a non-medical exemption that parents can take after they've obtained one. And the hope with that is to better understand why parents and families are choosing to get non-medical exemptions. There was a report put together based on that information, as well as a series of interviews that took place. The report's being reviewed right now, and more information should come out shortly. But I just want to let you all know that we're seeing this increase. You know, we're taking a look, and then again, there's this report coming out soon that should give us a little bit more insight. That's all I have for non-medical exemption rates. I do just want to take this opportunity to say that as providers, we really appreciate everything that you do to ensure vaccine access. And as we're seeing these increase, like everything that you do is just going to become that much more important. So thank you for all the work that you all do. The next thing I'm going to talk about is the Oregon Medical Exemption Form. There were three major changes to the Oregon administrative rules around school and childcare immunizations. A few months ago, these updates were finalized, and there was a whole reorganization of the rules and a lot of minor changes and three fairly large changes. I'm going to talk about two of them briefly, and then the third one in more depth, which is the Oregon Medical Exemption Form change. The first change is exclusion day moving from the third Wednesday in February to the fourth Wednesday in February. For those who are unfamiliar with the term exclusion day, that's the deadline for families to have up-to-date immunization or exemption records on file with their school or childcare. The purpose of this change was just to give families one more week to get immunizations after they receive their exclusion letters. It'll also give a buffer for issues with mail delivery and weather that may occur. You may notice February, a famous time in Oregon for bad weather. And so that can really impact whether people are getting their mail on time and the ability to get vaccinations depending on where in Oregon they live. This will come into play in 2026. The next exclusion day is February 25th, 2026. The second change, children who have a history of varicella disease will now need a healthcare provider verification or lab test instead of parent verification. Note that documentation from Alert IIS is also acceptable. The purpose of this change was to align varicella immunity documentation with that of other school-required vaccines. Before this change, it was the only required vaccine that had a parent verification option. When does this go into effect? Applies for new documentation submitted on or after August 1st, 2025, and it's not retroactive. So anything currently on file for students can still be used. It's only for new documentation moving forward. And then the final thing that I'm going to talk about and highlight a little bit is that physicians will now be required to fill out a form rather than write a letter for a medical exemption. Before, you know, if parents wanted a medical exemption for the kiddo, they had to go in and get a letter written. We wanted to make that process a little bit easier. So simplifying the process and making sure that we have a document that has all the necessary information on it. And again, this is similar to the previous one in that it goes into effect August 1st, 2025. So anything currently on file, any letter currently on file for a kiddo, okay to still use. Going forward, we're going to want to be using this form. and I'm just gonna go over the form really briefly. It's fairly self-explanatory, but I just want to show you where it's available on our website and what it looks like generally, and then I'll put that link in the chat when I'm done chatting. Before I do that, I just want to tell everyone that the process for obtaining a non-medical exemption has not changed. That process was not changed, exactly the same. It's the medical exemption piece that's a little bit different. So I'm just going to click on this and hope that it loads in a reasonable amount of time. Okay, I'm just moving this over. So when I click on that, it brings me to our exemptions and immunity documentation page. This has general information about the various kinds of exemptions and immunity documentation, and then you can click on links to get a little bit more information. The first one that is here is our medical exemption, list of the CDC's contraindications and precautions available here. And then on this third paragraph, if we click, we get our form. And it's loading. There we go. Perfect. So this is the form. It's 2 pages, front and back. And the one that physicians are going to have to worry about is our Section A. There's 2 sections, Section A and Section B. Section A going to be completed by a physician. The second page has directions for how to fill it out. Pretty simple directions. Step 1, fill out Section A, and Step 2 is return this form to the child's parent or guardian and keep a copy for your records. I'm not going to go over this in any huge detail, but there's the biographical information, child's name, date of birth, the school or childcare, information about the medical condition that is a contraindication or precaution. And again, if you have any questions about what those are, there's a link on the previous page and available on the CDC website. You indicate which vaccines are contraindicated or have a precaution. You can choose one, you can choose as many as are relevant. Determining whether it's permanent or temporary, and if it's temporary, putting the date that it's expected to resolve. And then just information for the physician, their signature, the clinic's name and address, and so forth. So that's what you'll do as a physician. You'll fill out this part. You'll give it back to the parent or guardian who's probably just right there waiting for it, or maybe they've sent it to you through like an online portal or email, and then you'll keep a copy for your records. Before I finish up, I just want to go over some frequently asked questions we get about the Oregon medical exemption form in case there's something that popped up, and I can answer that real quick. The first question, if a child has a letter from a physician for a medical exemption, do they need to submit the new form? Like I mentioned before, medical exemptions on file with the school or child care before August 1st, 2025 are still acceptable. Anything received after August 1st, 2025 needs to be on that form I just showed you. Second question, who can sign the Oregon medical exemption form? Who can sign it is a physician or a representative of the local health department. What is a physician for the purposes of this administrative rule? Well, in order to know that, we're going to look at the statute, ORS 433.235. I'm not going to pull it up, but I will read it to you. Physician means a physician licensed by the Oregon Medical Board or by the Oregon Board of Naturopathic Medicine, or a physician similarly licensed by another state or country in which the physician practices, or a commissioned medical officer of the Armed Forces or Public Health Services of the United States. So that's the definition of physician that we're working with. And so when I read that, I often get the question, does that mean that a nurse practitioner or physician associate can't sign the Oregon medical exemption form? And that is correct. It's also not a change. It was always a physician or representative of the local health department, and that's because it's codified in the statute. The term is defined in the statute, and we don't have an ability in our administrative rules to change or expand what the definition of that is as much as we might want to, because I know that a lot of people see nurse practitioners or PAs as their primary care providers. If a school does receive documentation from a different healthcare provider, such as an NP or PA, they can work with their local health department to fill out the form because, again, a representative of the local health department can fill out the form. So that's a little bit of a workaround if people need them. That's, I would say, like our top top one most asked question, not just about the Oregon medical exemption form, but about the administrative rule change in general. A very valid question, a very good question, and that's the answer. These are all the resources that I mentioned. I'm going to put them in the chat. But this might help answer any questions that have come up while I'm talking, and then also give you access to some of the data that I talked about. If you have any questions, a great way to get in touch with us is this Oregon inbox. It goes directly to a group email shared by all the school law people. And if we don't know the answer, we'll definitely go get it for you. So that is my presentation. I don't know if there are any questions or if I missed any in the chat.
Oh, sorry, Kelly, it does look like there's one in the chat.
Okay.
Will alert IIS history of varicella continue to be based on parent report, or will clinics entering that field need a lab or clinical documentation to add history of varicella infection?
So my understanding, and Mallory or Monse, if you're on here and I don't get this right, feel free to pipe up. But my understanding is that as long as the provider entering that data feels that they have sufficient information to verify that the child did have varicella, then it would be entered, then that could be entered into alert. That's my understanding.
And Kelly, this is Jenny McKibben. Can I chime in?
Yes, please.
Thanks. I didn't want to interrupt you. So that is definitely the right answer. We have not looked into the need to make the change within Alert IS and how people utilize it. But Cynthia, I do 100% appreciate that question, and we'll be taking it up with our clinical counsel that we have here with the immunization program to find that answer. To tell you, we will tell you in the future if that answer has changed from what we currently have right now. Thanks.
Thank you for posting those links that were also in your presentation. Are there any other questions for Kelly? Seeing no hands raised, if anybody wants to chime in, go ahead. But at this point, I will thank you, Kelly, for joining us and for providing all of this useful information. It's much appreciated.
Thank you.
What's next on our agenda, Anne?
Jenny is up next with the Alert IAS replacement project.
Okay, thanks everybody. I'm sorry, I am trying to turn my video back on. There we go. There's always some technical issues. Hi everybody, I am Jenny McKibben. I use she, her pronouns, and I am the Alert IIS Director for the immunization program. And I am happy to be here today to share with you some updates. I do not have slides for you. I am just going to share some updates for the Alert IIS replacement project. So, as you all know, we are working tirelessly to replace our current product, the current system that we have now. For any of you who use it, you know that it is working and it has provided a great service for all of us, and its time is ending. It is time for us to move to a new, more modernized platform. So I'm happy to say that we continue to move forward with all the necessary aspects of procuring a new system. And with that, I'm happy to say that we are on track to release the request for proposal by the end of the year. And so with that, I did want to share a few highlights. So for any IT project of this size for the state of Oregon, we are required to work with an IQMS contractor. And what that means is that is an independent quality management services contract that will come and review and provide guidance to our project. And so the intent is to bring in an outside reviewer who is independent and objective, and to help identify any problems that we may have. So right now they have been onboarded, and we are happy to say that it is with a company called NTT Data. They have done other work with the state of Oregon, and we're very happy to be working with them now. To start off, they'll be reviewing our project documentation that we already have complete, and providing probably the first biggest thing is providing guidance around our project documentation that we hope to include in our request for proposal. So they have started, and we are happy that is moving forward. The other thing I wanted to really focus on today is just a reminder of how we are incorporating community engagement into our project. It is definitely an important piece of our project, and it's just a quick reminder that we did do some listening sessions last year. In those listening sessions, we had them around the state. A reminder, we had them in Ontario, Pendleton, Redmond, excuse me, Richmond, I don't know where that came from, Klamath Falls, Coos Bay, Hood River, and McMinnville. And we got a lot of really good feedback from those listening sessions, and we have incorporated that feedback into the planning documentation, that same documentation that's currently going to be reviewed by NTT Data. So, and probably the most specific piece where they were incorporated was into our system requirements. And so we have a very large document that is a full list of our requirements, document for our requirements of the new vendor and of the new system. And then the other thing that we are embarking on, which is exciting, is the Working Steering Committee. And we have asked you in the past to provide either ideas, or if you are somebody who was interested in participating in this Working Steering Committee. And it's been a long time coming, and we are very excited that it is actually starting. So this Working Steering Committee was established by our Alert IS Replacement Project to really have our partners consult and review our various project activities and provide us guidance, right? So ensure that we want you to see what we're doing, provide, guidance around recommendations or any issues that you might find that you want us to be aware of. And all of that is going to start very soon. In fact, our kickoff meeting is going to be, very soon, Thursday, September 18th. And with that, we have so far 20 members who have said that they would like to participate after 2 rounds of recruitment and outreach. So that's exciting. 20 members was our goal. And so we will have that kickoff meeting, which will include those members as well as our Alert IS project core team. Hopefully we will all be able to attend to introduce ourselves and meet each other for this project moving forward. So with that, the representation from the different groups within WSC is, it's by different groups of users, by their program, by their role, and by location. So we have members around the state, as well as in different roles from what they do around immunizations, from clinical staff, as well as school and daycare members as well. Okay, I think that is all I really had to say. I'm definitely open for some questions. I will put in the chat the email. So if you do have any questions around either the project or the Working Steering Committee, you can definitely send them to our Alert IS Replacement Project email. And I'm going to end with that. So if there's any questions, please let me know.
Thank you, Jenny. Let's see. I don't see any hands raised. Thank you for placing that email in there. It looks like we may not have questions today, which is good. Nice, thorough update.
Thank you.
Thank you so much. Okay, everybody. So I think moving on, I wanted to make an additional announcement. Many of you know that our former OIP medical director, Dr. Paul C. Slack, retired in mid-July. And while we will all miss him and we wish him well, I am excited to announce that we do have a new ACADP and OIP medical director starting with us on September 8th, and that is Dr. Howard Chow. Dr. Chow will be with us hopefully at the December IPAT meeting, and we will send out some introductory announcements when he joins the team. So just wanted to make sure you all knew that. I also wanted to introduce a new IPAT member, and that would be Dr. Allison Chang from OHSU Pediatrics. And I know that you're on the call. Would you like to introduce yourself, Dr. Chang?
Yes, hi. I'm so sorry for being a few minutes late. It seemed very fitting that we were having an OHSU meeting about COVID vaccines, and I said, I need to go to the other COVID vaccine meeting. But yes, my name is Allison Chang. I'm a general pediatrician over at OHSU. I work very closely with Alana Braun, who has been on this committee for at least this past year and for potentially longer. And I also co-chair our vaccine and immunization practices subcommittee for OHSU as well. So kind of have my hand in a few different places at the moment. Happy to be in this group and learning a lot already from this first meeting. So thanks for having me.
Thank you for joining us, and we will really appreciate your perspective and your voice in the months to come.
Yes, happy to weigh in. We have had many meetings this past week alone with all the different things that have been changing. So I was texting Alana that I feel actually quite lucky because this group, I recognize not everyone in this particular committee gets as many updates as we do. And so I'm happy to weigh in when I have other things, but Dean obviously gave a great review and update today for everybody here.
Okay, thank you. We'll keep that in mind. That's very helpful. And yeah, this is our quarterly meeting, but this is the week to be having it, I suppose. So we really appreciate you all being here and all of your great questions. With that, I want to check that we have, before we go, that we have any member updates that anybody wants to offer. So if there's any updates you want to provide or comments that you want to make about anything, this would be the time for our membership.
I just wanted to jump in and say I'm also a new member, Ann King. I'm the state director at Comagine Health, and we've had a representative here, but I'm now your new representative. Nice to meet you all.
And thank you so much for jumping in with that. I didn't realize that you were on. I should have called you out, but welcome so much, and we're glad you're here.
Thank you.
Right. Any other announcements? And I want to add that this is also the time to offer any topics that you would like to see discussed at the December meeting, or if there's anything that any members want to present on that they're working on, especially if it's something that you are working on and you want to get some feedback from your colleagues on IPAT. This would be a really great venue for that. And if you can't think of anything that you want to bring to the floor now, please do remember that you could reach out to us with those topics as well. All right, I see a hand raised, Deborah.
Hi, I'm not volunteering to speak to present anything, but one of the things that I've been thinking about specifically for pediatrics, but across all other providers too, that could be helpful. I think that we're entering a new state of vaccine hesitancy that previously one of the ways to address that was through motivational interviewing. And I think that just with this heightened political environment, there might be new strategies that providers will need to employ or deploy as they speak with their patient population. And so I wonder if there's any OHA sponsored trainings that could be considered that speak to a different, if there's any changes in the type of ways to address vaccine hesitancies with patients in this heightened environment, that could be something very helpful to provide to providers. So I'm not volunteering anything, but just starting to percolate and think about that and what might be helpful in a different way.
No, thank you. That's very helpful. And that is something that we can put for consideration if we can find something for the December meeting, or if anybody has any resources right now, please let us know. Thank you for that.
Cecile, this is Rex from the Oregon Immunization Program. I don't have any specific resources. I definitely share your concerns. I think motivational interviewing often works when there's a clear, scientific and social consensus around something, and someone sort of, has that knowledge that their behavior may not be best for them, which I think you're right, is starting to become eroded in the current environment. But I was going to say the Northwest Immunization Conference is coming up. It starts this month, and I know there are often a lot of trainings offered through the Northwest Immunization Conference on topics like this. I know there's several OIP presenters as well, so it might be worth a look at the schedule and agenda for that to see if there's any good training opportunities there. And I think we can send that out. Is there anyone on the call now that was involved in that wants to share anything about it?
Are you talking about Immunize Oregon, Rex?
Yep,
Yeah.
this is Molly Sachs with Immunize Oregon.
Oh, Molly's there, good.
But I'm having some tech trouble. So Albert, if you can drop in the link to register, or our website has all the list of sessions, that would be great. And we'd love to see everyone there.
Oh, great. Looks like Kelly McDonald dropped that link in. Thank you very much. Oh, no, that is a link to Boost Oregon for motivational interviewing. Excuse me. So we're still waiting on a link, hopefully from Albert, on the Northwest Immunization Conference.
Thank you, Albert and Molly.
Yeah,
That was my only comment. I didn't have anything else.
I'm dropping it now. Just be aware, there's each session's an individual registration, so you're going to see a whole bunch of them.
Is that because it's a virtual gathering?
Yeah, and it's over several days, so they're all kind of separate.
Sorry, it's totally virtual. I will make one correction on that, Albert. You register once and you get all the links. So you could show up to 10 sessions, or you can show up to just one, but your one registration will get you into any of the sessions.
Even though they're all separate on the page?
Yes, because are you within the community platform when you're talking about them all being separate?
Yeah.
Yeah. So that's because that's where we'll put slides and things. But if you click on that Zoom register, it will take you to the one place to register for all of the sessions.
Okay. Yeah, I have the link. I'm just trying to figure out. I don't see a chat option on my screen, so I'm not sure how to drop it in for everybody. Any suggestions? Oh, there it is.
You don't see a chat on the bottom toolbar.
Okay.
And if I send it to you, could you send it to the whole list?
Looks like Albert got it in there.
Okay, great.
But yes, I could send it if you ask.
Okay, I can send you more details because there may also be members who aren't on today.
Perfect.
Thank you all, and thank you, Rex, for bringing it up.
You're welcome.
Are there any other members on the call who are presenting at this event? Okay, just thought it might be an opportunity for you to talk about your topic.
Dean is going to present with Rex, and the school law team is also going to present a slightly longer detail. So if anyone missed this and is interested, that's a great way to get the updated school law information.
That's great. Thank you, Molly. All right. Any OIP announcements that we want to do on this call for the membership? And if not, we will be able to give you back some of your time today because we did not have an agenda that took the whole meeting time. So if we don't have any more questions or anything, I will adjourn this meeting, and thank you all for joining us. And thank you for your patience as we generate messages and get communications out during this time. And please let us know if you have any topics or questions for the next IPAT meeting. We can take those and build that into the agenda. Thank you so much for joining. Have a nice afternoon.